Maria Santos had been cleaning the same hospital for 30 years, mopping floors, emptying trash, working unnoticed by everyone. Doctors and nurses knew her simply as the cleaning lady. Until that night when multiple trauma cases arrived and all surgeons were in surgery, Maria's hands automatically began treating the wounded patient, because those hands had saved hundreds of lives in field hospitals in Afghanistan 15 years ago. Welcome to Hidden Legends. Before we begin this incredible story of a hospital janitor whose gentle hands once performed life-saving surgery in the world's most dangerous combat zones, tell me in the comments where you're watching from today. And if you believe that true healers never stop serving, hit that subscribe button and share this story to help us honor those who save lives from the shadows. At 4:30 a.m., when Metropolitan General Hospital was at its quietest, Maria Santos pushed her cleaning cart through the empty corridors with the same methodical precision she'd maintained for 30 years. At 58, she had become part of the hospital's architecture, as reliable and unnoticed as the fluorescent lights that hummed overhead. Maria's routine never varied. Emergency room first, while the overnight chaos was winding down and before the day shift arrived. Operating rooms next, ensuring every surface was spotless for the surgeons who would soon depend on that cleanliness. Then, the patient floors, working her way up from the ICU to the general wards, timing her movements so she'd never interfere with medical rounds. The hospital staff knew her as a quiet, competent woman who spoke English with a slight accent and Spanish with the maintenance crew. She arrived early, worked efficiently, and left without fanfare. In 3 decades, she'd never called in sick, never complained about overtime, never asked for anything beyond her modest paycheck. What they didn't know was that Maria Santos wasn't really Maria Santos. Major Elena Rodriguez, U.S. Army Medical Corps, had been declared missing in action after an IED explosion outside Kandahar in 2009. The official report stated that her field hospital had been overrun. Her body never recovered. What the reports didn't mention was that Elena had survived, spent 3 months recovering in a Pakistani border clinic, and made the conscious decision never to return to her old life. The woman who emerged from that trauma had kept the healing hands, but lost the desire to be a soldier. She'd taken a new name, found work that let her help people without the weight of military command, and spent 15 years trying to forget the sounds of combat surgery performed under incoming fire. Maria had developed her own invisible protocol for monitoring Metropolitan General's pulse. As she cleaned, she listened. The tone of conversations between doctors, the stress levels of nursing staff, the subtle changes in patient room occupancy that indicated whether the hospital was having a normal day or bracing for something difficult. Her cleaning cart contained the usual supplies, but also items that would have raised questions if anyone had looked closely. Sterile gloves in her pocket, basic trauma supplies tucked beneath the trash bags, a small medical kit disguised as cleaning equipment. Old habits from a life where being prepared meant the difference between saving lives and losing them. Dr. James Harrison, the emergency department chief, passed her in the hallway most mornings. He'd nod politely, sometimes comment on the weather, but never really saw her. None of them did. To the medical staff, Maria was infrastructure. Necessary but invisible, like the oxygen lines in the walls or the electronic monitors that kept constant watch over their patients. Maria preferred it that way. Anonymity was safety. Invisibility was peace. But on Tuesday, October 15th, that peace was shattered. The first indication of trouble came at 11:47 p.m. Maria was finishing the third-floor patient rooms when she heard the emergency dispatch crackling through the hospital's communication system. Metropolitan General, incoming mass casualty, multi-vehicle accident on Interstate 95, ETA 15 minutes, repeat, mass casualty incoming. Maria's blood pressure spiked, but she continued pushing her cart toward the elevator. Mass casualty events weren't uncommon, and Metropolitan General had excellent trauma protocols. The ER would handle it. But as she descended toward the emergency department, Maria began hearing things that concerned her. Radio chatter about the number of casualties, conversations between nurses about available surgical suites, the controlled urgency and voices that suggested this was bigger than usual. The elevator doors opened to controlled chaos. Paramedics were wheeling in patients faster than the triage system could process them. Maria counted quickly. 8 serious trauma cases with more ambulances arriving. 3 operating rooms were already occupied with emergency surgeries from earlier in the evening. Dr. Harrison was coordinating triage, his voice calm but tense. Patient in Trauma Bay 2 needs immediate surgery. Where's our next available OR? Dr. Martinez is 20 minutes out, replied the charge nurse. Dr. Kim is finishing up now, but she'll need another hour. We can't wait an hour. Maria positioned her cart against the far wall and continued cleaning, but her eyes were cataloging injuries with the automatic assessment that had once saved lives under much worse conditions. The patient in Trauma Bay 2 had what looked like internal bleeding from a steering wheel impact. Classic pattern she'd seen dozens of times in convoy attacks. The young resident trying to stabilize him was competent, but inexperienced. He was taking too long with the IV, missing the signs that suggested immediate surgical intervention was needed. Maria forced herself to look away and focus on mopping the floor. This wasn't her world anymore. These weren't her patients. She was just the cleaning lady. The patient in Trauma Bay 2 was dying. Maria could see it in the monitor readings, hear it in the subtle changes to his breathing, recognize it in the color draining from his face. The resident was still trying to stabilize vitals, but what this patient needed was a surgeon's hands, not more IV fluids. Dr. Harrison, the resident called out. I'm losing him. Blood pressure's dropping fast. Keep working on it. Surgery's coming. But surgery wasn't coming fast enough, and Maria's trained eye could see that this patient had maybe 10 minutes before irreversible damage occurred. She tried to focus on her cleaning, tried to remind herself that she was Maria Santos, hospital janitor, not Major Elena Rodriguez, combat surgeon. Tried to silence the voice in her head that was calculating exactly which procedures would save this patient's life. The monitor flatlined for 3 seconds before the young resident got the rhythm back. That's when Maria's hands made the decision for her. She set down her mop, pulled sterile gloves from her pocket, and walked calmly to Trauma Bay 2. Excuse me, she said quietly to the resident, but I think I can help. The resident looked up, confused. Ma'am, you can't be in here. This is a sterile area. Maria was already assessing the patient, her hands moving with practiced efficiency to check pulse points, examine wound patterns, evaluate breathing. 15 years of civilian life disappeared as muscle memory took over. He has internal bleeding, likely from splenic laceration, she said, her voice carrying an authority that made the resident step back. You need to get him to surgery now, or he'll exsanguinate in the next 8 minutes. Who are you? The resident stammered, but Maria was no longer listening to him. She was listening to the patient's body, reading the signs that spoke louder than any monitor. Her hands found the pressure points that would slow the bleeding, applied compression with the precise amount of force needed to buy time without causing additional damage. Get Dr. Harrison, she said, still working on the patient. Tell him you need an OR immediately. The young doctor hesitated, then ran toward the attending physician. Maria continued working, her hands performing procedures she'd done thousands of times, in conditions far worse than this sterile emergency room. Stabilizing blood pressure, ensuring airway clearance, preparing the patient for the surgery that would save his life. Dr. Harrison appeared at her side within minutes. What the hell's going on here? He demanded. Then he saw what Maria was doing, how she was doing it, the professional competence in every movement. Who are you? He asked quietly. Maria looked up at him, her hands still working on the patient. For the first time in 15 years, she told the truth. I'm a surgeon. Dr. Harrison stood frozen as Maria continued stabilizing the trauma patient with movements that spoke of years of experience under pressure. Her technique was flawless, her prioritization perfect, her calm in the face of life-threatening emergency absolute. You're a surgeon, he repeated slowly, and you've been cleaning our hospital for 30 years, Maria replied, checking the patient's pupils. But I was a trauma surgeon for 10 years before that. Where? Afghanistan, Iraq, places that don't appear on most maps. Dr. Harrison watched as Maria performed a procedure to relieve pressure that was building in the patient's abdomen. It was a technique he'd only seen done by surgeons with extensive combat experience. "We need to get him upstairs," Maria said, stepping back as the trauma team prepared to move the patient. "He's stable for transport now, but he needs surgical intervention within 30 minutes. As the patient was wheeled away, Doctor Harrison turned to Maria, studying her with new eyes. The calm competence under pressure, the absolute precision of her medical interventions, the way she'd taken control of a life-threatening situation without hesitation. "Major Elena Rodriguez," he said quietly. "You're Major Elena Rodriguez." Maria's hands stilled. After 15 years of hiding, her real name sounded strange in the sterile hospital corridor. "I was," she replied, "a long time ago. You were listed as missing in action, presumed dead." "I should have been. Sometimes I think part of me was—" Dr. Harrison was quiet for a moment, processing what he'd witnessed. Then, "That patient you just saved, do you know who he is?" Maria shook her head. "Army Staff Sergeant, 2 tours in Afghanistan, Purple Heart recipient." He paused. "Just like the other 7 patients you helped save tonight." Over the next hour, word spread quietly through Metropolitan General. The cleaning lady who'd worked there for 30 years was actually a decorated combat surgeon who'd saved hundreds of lives in the world's most dangerous war zones. Nurses who'd never looked twice at Maria Santos suddenly saw Major Elena Rodriguez. Residents who'd passed her in hallways began understanding why her quiet presence had always felt somehow reassuring. But Maria herself felt exposed in a way that terrified her. For 15 years, she'd found peace in anonymity, healing in helping without the weight of medical responsibility. Being invisible had been her therapy, her way of serving without the trauma of life and death decisions. Dr. Harrison found her in the supply closet where she'd retreated after the emergency was over, trying to process what had happened. "The hospital administration wants to meet with you," he said. "They're talking about offering you a position in the surgical department." "I can't," Maria replied immediately. "I'm not that person anymore." Tonight was an exception. Those patients needed help and no one else was available." Dr. Harrison sat down across from her. "Elena, Maria, whatever name you prefer, you just saved 8 lives. Your medical skills haven't diminished at all. If anything, they're better than most surgeons I work with." "You don't understand," Maria said quietly. "I left that life for a reason. The pressure, the responsibility, the weight of knowing that people live or die based on your decisions, I couldn't carry it anymore. But you carried it tonight. Tonight was different. Tonight I could help and then go back to being invisible." Dr. Harrison was quiet for a moment. Then, what if there was a way to do both? 3 weeks later, Metropolitan General quietly implemented a new program. Maria Santos remained the hospital's senior custodial supervisor, maintaining her regular cleaning schedule and the anonymity she needed. But now she also served as the hospital's emergency medical consultant, available during mass casualty events when additional surgical expertise was needed. The arrangement was unofficial, allowing Maria to help save lives without the formal responsibility of staff physician duties. She could emerge when needed and return to invisibility when the crisis passed. It was a compromise that honored both her desire for peace and her inability to ignore suffering when she had the skills to help. Dr. Harrison had fought the administration to create this position, arguing that having someone with Maria's combat surgery experience available during emergencies would save lives. He was right. Over the following months, Maria quietly assisted in situations where her expertise made the difference between successful outcomes and tragedy. The hospital staff learned to recognize the signs. When Maria set down her mop and pulled on surgical gloves, they knew someone's life was about to be saved by hands that had learned their craft in the most dangerous conditions imaginable. 2 years later, Maria Santos still arrives at Metropolitan General at 4:30 a.m., pushing her cleaning cart through empty corridors with the same methodical precision. But now, when medical students rotate through the emergency department, some of them have heard whispers about the janitor who's actually a legendary combat surgeon. They watch her work with new eyes, seeing not just efficiency but the movements of someone who understands that Healing happens in many forms. Sometimes it's the precision of a scalpel in an operating room. Sometimes it's the quiet dignity of keeping a hospital clean and safe for the patients who need it. Maria found peace in choosing when to be a healer rather than being commanded to heal. She discovered that serving others doesn't always require recognition, and that the most profound impact often comes from the humblest positions. The young doctors and nurses at Metropolitan General now understand that extraordinary skill can hide behind ordinary uniforms. They've learned to look more carefully at the people around them, to recognize that sometimes the most qualified person in the room might be the one everyone overlooks. Because Maria Santos taught them that true healers don't need titles or recognition. They just need the opportunity to use their gifts when those gifts are needed most. This has been Hidden Legends, where extraordinary people disguise themselves as ordinary neighbors, waiting for the moment their unique skills are needed most. If this story moved you, share it to honor those who heal us from the shadows. Subscribe for more incredible stories of hidden heroes and tell us in the comments. Have you ever met someone whose gentle hands carried more strength than you imagined? Because sometimes the person mopping your hospital floor is the same person who once saved lives in the world's most dangerous places.